exchange and innovation around AMR. AMR is a global threat. It transcends hospitals. It touches agriculture, environment, water system, animal health. And so our response must be holistic. This conference must become the lighthouse that signals national readiness, action, and collaboration. We are deeply honored today by the presence of our distinguished guests, our keynote speakers and panelists, and you, our participants. Your continued support reminds us that we are not alone in this fight. Remind us that when we work together, health workers, researchers, institutions, and communities, we can defeat even the most silent killers. For our fellow young people in this room, I urge you to take up space in this movement. Your innovations, your voices, your passion are what will shape the future of AMR response in Liberia. We look forward to the knowledge we'll gain, the partnership that we'll deepen here today, and the commitment we'll renew throughout this conference. Once again, thank you for answering the call. Let's work together to ensure that technology becomes not only a tool, but a turning point in our national fight against antimicrobial resistance. Thank you all for being here, and welcome to our conference.
Speaking was the voice of Martin Fogba, the Executive Director of Consummate Health and Sanitation Organization.
A remark on WHO Liberia. In WHO Liberia here, Africa CDC. You are welcome, sir.
Good morning. You excuse please my accent, but I also have some issues trying to understand Nigerian speaking Liberia, especially your local. So if you don't get me, just need to the keynote channel. That's okay. Alright, I'm Bata Soko. I'm the Africa CDC country representative for Liberia. Now that I know that WHO or other partners are looking at that, so because we are here for in Africa. So if one partner is not on the ground as a global one, the other partner is Sinkor. So on behalf of WHO and other international partners, I would say this is an honor to recognize the presence of international partners in Liberia. And with regard to the issue of the discussion, that is the AMR, that's the antimicrobial resistance, it's very important to understand that there's a lot of disease-borne associated with it. Within the global perspective, let's say Africa, for example, now we have about 27.3 million people, 7.3 of 100,000 population which are dying because of all this continent. So that shows a big burden for all of us. And then we also have to understand that there's a lot of risks involved in terms of the So people are taking medications, antibiotics without prescription. And the frequency is within our local communities. As somebody somewhere, I use the Uganda experience and some countries are this way. I've taken antibiotics for cough and it works for me. Now somebody's coughing, I say, oh, take this antibiotic. So we don't even know what is the strength of that antibiotic is taking or the dosage is going to take. But these assumptions are there and these are all contributing factors to problem we are facing. Now the other aspect is globally there's a challenge. What do we have in order to support or strengthen the services in global countries? These are our biggest challenge. We don't have the resources as required, we don't have the manpower or capacity to deal with this. And then the awareness also is very important. So it's very challenging for all of us to look at that global perspective also. Now the other issue also, we also have the people at risk, children and those who do self-medication. This is very, very important that we understand that medications, they are all, there's a regulation to prescribe medications. So we need to also have this also. Now, if you look at the solution to this, Africa CDC as a continental health we believe we cannot do it as an individual organization. We have to do it in partnership with other existing organizations, either locally based or other international organizations in member countries, including the ministries of health and other key players that we have. Let's say, example, if you want to make sure that the system works, our approach is to look at a comprehensive approach whereby you can have the police, you can have what we call the drug law enforcement in the task force, you can have the drugs and medicine control in the task force, and you people, in the advocates, so that we create awareness and we know why we are taking medication so and so. We don't have to be random. It's not everybody's responsibility. So what institution cannot do? So we are encouraging collaborative efforts. And today this is an evidence of that. It's not only the Minister of Health here or One Health here or other institutions, but all of us. I don't know whether in the list we have the police or security forces here. Or from the Pharmacy Council or Medicine Control, do you have any of them here? I believe with the support that we are all here for and committed to ensure this is working, is going to work. Let's just assure of that. It will not take 1 day or 2 days. It is going to be a continuous process, and then we can do that. And we cannot achieve this without capacity building. It's very important. If you want to inform people about any problem, those people need to have the technical know-how. Even you, in power,